Well, hello. I'm going to do something I think interesting because, I have not read back any of my postings about my leukemia at all. I think I read a couple, but not recently, or listened to them or watched or whatever. I wanted to kind of start at the beginning and see how close I am because, you know, how we look at things when we're going through them are different than how we see them once we've been through them. Um, I was diagnosed on March 30th. I had body aches, mostly in my legs, but I didn't have a fever to go along with them. Um, I had gone to an urgent care. They suggested I go to the University of Colorado emergency room. So I went there with my daughter. Had no idea that that was going to be it. And from that day on, that's the day we were diagnosed. I was diagnosed and got admitted immediately to the hospital. Did not know that was going to happen. So it was quite a whirlwind. I do remember thinking, I just got to do this. I have no choice. I mean, it wasn't even, I don't even think I thought, here I go. It just happens. And so, they admit us, and the first few days were really hard. I had a headache that would not go away. It was not a headache, a jaw ache. And they didn't let you take Tylenol or ibuprofen or anything like that because it masks fevers, and that's what they're really looking for. And especially when your blood count is so high, and you're cancerous, basically, and when your blood count comes down because it's zero or close to it. So they have to be really careful about that. Um, but then, see, things seem to, get better. I was taking the drugs. The type I had and the way that hospital deals with Philadelphia positive ALL is instead of giving you cancer at the time to kill those white blood cells or chemo, they give you what they call dasatinib and a steroid. And basically, it does the same thing. It's just because it's a different type, it works a little differently. So I was lucky in the respect that I did not have to worry about taking chemo in the early times, which was definitely easier on my body, I think. However, the steroids were a pain in the butt. Um, they were really hard. They made me a different person. So, as we were going through that, there was good and bad days. They usually dealt with more so the procedures. I was there 3 days, 2 days, 2 days, and they had to put a PICC line in my arm, and that they have to numb. And what they do is they do like an IV, except for they put a tubing up to the vein. The vein goes all the way around, and the tubing goes all the way around up to your heart. And then they put two catheters on it, so basically they can draw blood and do IV at the same time, or put two IVs in, however they need to do it. It works that way. So I had that done, and then not too long after that, I had a biopsy done, the bone marrow biopsy, which is not horrible. Um, it's a test that they are very good about. They sedate you a little bit. You don't really kind of know what's going on. You get pretty good sedation. They give you the little numbing shot beforehand, thank God. And then they drill, and I don't see the drill. I don't even remember hearing it. I'll let you know next time. I have to take one another 10 days, but I don't even remember hearing it. So the first time I dealt with it really well. Um, However, your back is sore, quite sore for a while. So I have to remember that because I want to have it done it again. And later on in that stay, I developed some kind of infection. Well, the infection was caused by my IUD. I had an IUD in. It was going on probably the eighth or ninth year. It was a 5-year IUD, but because of my age, my doctor said, and I'm not looking to have it prevent, I didn't have it there to prevent pregnancy. I had it there to prevent blood flow. It was too much. She said I could just leave it in. So I did. So what happened was they took me down to CT scan. And they did a CT scan around my hips, and there was pockets that were holding fluid, which was an infection. So it took them like 4 days to figure out what kind of infection. Now, in the meantime, they're still giving me antibiotics for it because that could run away, really quick. And just so happens they haven't seen anything like that in 35 years. It's just crazy. So my legs really hurt, and that's what prompted us to go down. I didn't have a fever or anything. They just really hurt. And I thought it was the way I was sitting. I was coloring and sitting up funny. Um, and then I remember, let me tell you what I remember. I remember this part starts getting really foggy because I do get home. They figure out what kind of infection it is. Now they know how to treat it with what antibiotic. The antibiotic they were treating it with was working. They were able to get more specific. That way I talked to the infectious disease department, and I had all kinds of tests done. They did ultrasounds of the vein in my leg. They did ultrasounds of my heart 2 times. They did ultrasounds of my belly. They did ultrasounds of a lot of things while I was there the first time. 2, you have to be really careful when your white count gets that high. It can start affecting your organs. So if you have a flu-like symptoms that don't seem to go away in a few weeks, 3 or 4, and you don't have a fever that goes along with them, or maybe you do, but it's barely, get into the doctor, because the longer the white cell counts keep going up and up and up, your organs start getting damaged. So the sooner you can get it, the better. The problem is most people don't know when they have it. I went in because my legs hurt. I felt like I had a flu. I was taking Motrin. Motrin was helping. But really for me, it was just my legs, and it was just my thigh area that hurt. My arm hurt just a little tiny bit, but it still felt like the flu. But I didn't have a fever, and I just thought it all odd. So I had so much going on in my life with my mom's surgery, and I thought, well, maybe I've just been working my thighs too hard because I was trying to compete and see if I could get those bigger. There was a lot I was doing, so I kind of took away one thing at a time, and it still wasn't going away. By the time I started hurting, I went in probably 3 weeks, maybe 4 weeks. I don't think it took me 4 weeks. So it's really important to go in quickly. So the next thing is I get home, because you get a break. They wait till your neutrophils are up to a certain degree and you get to go home. You go to the outpatient 3 times a week. They make sure you don't need any platelets or blood. They make sure that you don't have any fevers and everything's moving along the way it should. So we were doing that, and out of the blue came me not acting right. Now, a lot of people blame it on a fall. It was not a fall. I fell later when I had I call it a brain bleed because I can never pronounce it. I fell after, and I fell because of it. I did not get it because I fell. So they still have it on my chart that I fell. And it kind of irritates the hell out of me because that's not what it was. That's not what caused it. And I've said that. My mom kept telling me it was because I fell, and she happened to be there. I was like, no, I don't think so. So I didn't fall. Now, I had lost total equilibrium. So they took me. I went to one of the big outpatient things, and one of the receptionists actually noticed how bad I was walking and told somebody. So they sent me down to get a CT scan. Lo and behold, it was horrible. I got admitted to Neuro ICU that day. They took a hole out of my head and drained it. Now, I don't remember a lot. I remember one of the nurses. I remember that hurt, but not as bad as it coming out. And I will never forget how bad it hurt coming out. Never, ever, ever. After I was done, I laid there for 2 hours. I was not wanting to go on with anything. So far, even with what I've been through, that's been the worst. So then I got to at least enjoy home for a couple more weeks before I had to go in for the transplant. And once you go in for the transplant, you're there, you're at the hospital for 4 weeks. And the area they have you in only has like 5 rooms. So it's a very small area. Um, Maybe there's more, but it's a very small area. So it's even hard to get up to get to walk. And it's almost depressing to walk. So I'm feeling the aftermath of that. I should have been walking and I'm not, and so now I'm weak, which will be fine. I'll get through that. That's not a problem. Day by day, little by little. I'm not doing too much. I sit down as soon as I don't feel well. I need to get better. So when I did go in for that, it was anticipation. They put this lovely thing in, and what they do there, they took the PICC line out of my arm, and this is kind of like the same thing, except for it has three things you can pull blood or IV out of. There's 3 of them. See? So they can do that, and they also told me that they needed a bigger area when they're putting the stem cells in. They don't want anything catching them up, and this works better. It's ugly as sin, but who cares? I do in a way, so it does bother me. I'll just stress accordingly. It's only for a few months. But that way now when I go today, let's say I go and they're going to take my blood regardless, I don't have to get poked. And if they need to give me platelets, I don't have to get an IV. It's just all set up. It's ready to go. It makes it easy. And it really does make it easy. This time when I was in the hospital, I had 3 hooked up to me most of the time, 3 IVs. So it was definitely needed. And so when you get there, you get this put in, and then they give you a day off, which is the day you got this put in, which is, you don't really get a day off. And then the next day is chemo, your first bout of chemo. And it begins with an F, I'm not sure. And then there's 2 chemos the next day. One that begins with a T, one that begins with an F. The F one goes through in about less than an hour. The T one takes 4 hours to go through. The same thing happens the next day. I felt good until the 2 of them went, the double dose that day. After that, I really struggled with the nauseousness and the tired and the fatigue and the everything hit. Could not eat, didn't have an appetite, everything tasted like crap. Still does to a certain degree, but I'm getting more and more used to it. So those were the hard days, I would say, all through that. So that was day minus 5 and 6 were the 2 chemos. So day minus 5 and day minus 4 were the double chemos. Day minus 3 was a regular chemo. Day minus 4, 2 was a regular chemo and radiation, and then day minus 5 was radiation. So it's different in a lot of ways, that there's so many cancers that you get it taken out and then you get chemo, and the chemo like goes on. You don't get chemo bam like that and hard like that. They have to kill it all at once because it's one big organ. I mean, your blood is it's a moving target too, it's going. It's hard to get to. So once that happens, then they wait for everything to go to 0, which it did. My white blood count was at negative less than 1. And then it's just wait and see. You get your drugs to help prevent infections and viral infections and fungal infections. They give you drugs to help you deal with graft versus host, which is where these new cells think that your body is foreign and attacks it. They give you things because some of the other things they give you may cause bladder problems or this, so they give you things to protect that. So there's a lot of drugs. And when you're nauseous and don't feel good and you have to take all these drugs, it's like there's got to be a better way. Someone has to invent something that's better because it's just so hard on your stomach. And then you get so full, so you don't have any appetite, and then you get full from taking your medicine. What the heck is that? So the way I look at it, it was some tough times, and then it was getting used to it. And then tough times, and then getting used to it. and then tough times and getting used to it. Tough times getting used to it. Now, for me, the shock, probably 2 days after the shock were the worst, was one of the worst times. It wasn't the shock itself. For some reason, that didn't hit. It hit later. Oh my God, what does this really mean? Which was good, because then me saying, what does this really mean, made me pay attention. Made me pay attention as much as I could to what I have and what the doctors want and what the doctors expect. There were days where there were never any days except for one that I did not want to go on. That unscrewed, when they put that tube in and they unscrewed it from my brain, I can't tell you the pain I was in. It was off the charts. Off the charts. I would have given anything just to pass out right there. I mean, it was horrid. And it was a twisty feeling too on top of it, so it wasn't just pain. You knew that it was what was happening, and it was just so bad. The chemo was bad, and this whole thing is not fun, dealing with the nauseousness and the appetite. That's just hard. And right now I'm dealing with fatigue, which I'm just not used to. So the deal is, do something, sit down, do something, sit down, do something, sit down. And I have to do it. But I have to keep doing something too, because I don't want it to completely go away. I gotta work to something. And part of the whole thing too is that I don't eat real well. I'm not eating real well. I need to eat better. So, matter of fact, I'm gonna go have an egg salad sandwich, and hopefully it stays. But I just kind of wanted to get an idea of where you're at now. So now I'm out. Cure is not considered until day 100. I'm at day 22. So day plus 22 is where I'm at. Day plus 100 is when you are considered cancer-free and cured. Day 80, though, says a lot about, you start reducing your medications and things start going down a little bit. The good thing about leukemia, it is a transplant, but you are not taking transplant drugs forever. It's temporary, which is really, really, really nice. So kind of now it's just a waiting game. Just stay healthy. Don't get any infections. Wash your hands. Sanitize. Wear a mask when you're in public in some places. Just be diligent. And I'm going to be extra diligent, because I have been through enough, and I'm not going through anymore. I'm just not going to do it. It's not fair. So it is getting late. 17 minutes is a long time. I hope you watch it. Take care, and I'll talk to you soon.